Please subscribe our channel and press the bell icon. Today our topic is cardiac markers. Cardiac biomarker are substance that are released into the blood when the heart muscle is damaged or stressed. Whenever the blood muscles are stressed, so the cardiac markers are happening in the heart substance. For example, the chest pain is also the example of the cardiac marker. Whenever the muscles is stressed and damaged. Characteristics of ideal cardiac marker. Number 1. Cardiac specific, sensitive. Number 2. Easy to measure. Number 3. Absence trace in blood normally. Number 4. Not expensive. Number 5. Release rapidly after myocardial injury. That's all the characteristics ideal of the cardiac markers. Cardiac marker. Number 1. Myoglobin. Number 2. Troponin. Number 3. CKMB, AST, LDH, NT, ProBBN. Number 1st. Myoglobin. Myoglobin is protein present in the heart and skeleton muscles. It increases the rate of transport O2 within the muscle cells during construction. Increase in serum myoglobin occurs after trauma to either skeleton or cardiac muscles as in crush injury. Time sequence. Onset 30 hours, peak 2 to 4 hours, fall window. Rises rapidly. Sensitive marker, non-specific, all increase in skeleton muscle. Normal range 25 to 72 ng/ml. Troponin. Troponin is a protein present in heart and skeletal muscles. There are 3 types: troponin C, troponin T, troponin I. Troponin I and T highly specific and sensitive to cardiac and therefore known as cardiac troponin. Troponin I is thought to be more specific marker of cardiac damage than troponin T. Troponin time sequence is onset 2 to 4 hours, peak 12 to 24 hours, fall 10 days. Very specific marker, rise yearly. Late marker normal range troponin I 0 to 0.4 ng/ml, troponin T 0 to 0.1 ng/ml. Chest pain is recognized. Number 3. CKMB. First, creatinine kinase is the enzyme of presence in heart, skeletal muscle and brain. 3 isoenzyme of CK. Number 1 CKMM skeletal muscles. Number 2 CKMB heart muscle. Number 3 CKBB brain GIT tract provide energy during muscles contraction. CKMB is used for diagnosing heart attack. CKMB time sequence is onset 2 to 4 hours, peak 6 to 10 hours, fall 3 days. Very specific, rises early, good for early diagnosis.